Hello, everyone. I welcome you all to today's session. So, today is something that it's not about any kind of studies per se. It is just about the basic orientation that we need to know prior to starting the residency. Okay, the psychiatry residency is a bit it's a bit different from the other set of medical specialities. Remember, that is why we have to have a bit of orientation regarding what is how to approach, what to do. Okay, so let's start with any delay like any further delay. Let's start. Okay, so see, I first of all I welcome you all to the psych universe, that is the psychiatry universe. It's a big kind of a thing. Remember, it has multiple subspecialties, number one. Number two, you'll be able to see that as time passes you'll be able to find some kind of interest. It is not that general psychiatry is the only thing, child psychiatry is the only thing, or geriatric or addiction. You'll be able to find that there are multiple different avenues of psychiatry which will make you feel interested, or you'll be able to find your interest in those set of avenues. Okay, now see, usually if you look, there are multiple problems. As a resident, you have to spend late nights, you have to read quite a lot of books, endless notes, and see, always and always you will have this feeling that why does psychiatry still feel incomplete? And we all have been there. So it's not your scenario, it is my scenario, it was my scenario, it was us when we were doing our residency, we also felt the same. Okay, so we'll all be working very hard, but we'll be still be feeling that okay, everything is scattered, nothing is clubbed together. Okay, we'll be feeling that okay, I haven't completed this, I have missed some point, I'm not able to give my 100%. So that kind of frustration will always be there till the residency comes to an end. Even after that, when you start your senior residency, it might continue. Now, even if you read as much as possible, yet you will feel that something or the other is making that reading not adding to the value. It means that even if you're reading quite a lot, it is not adding to the value that is required. Okay, so the understanding part is definitely at stake. That is one different aspect of psychiatry, because psychiatry requires basic understanding of brain. Plus, it has multiple different newer avenues, okay, which we are not exposed to when we were doing our MBBS. So that is the biggest problem of psychiatry, because psychiatry was always a short subject in MBBS, and we used to get hardly one or two questions in medicine in the final prof exams, and that's it. So we don't have anything proper kind of psychiatry training when we were doing MBBS. And when we land up in psychiatry, we'll see that whatever we are reading, it might not be converting to the understanding part. And whenever we try to connect the concepts also, we'll be finding that it is not coming out as a complete picture. And because of that, we started as a platform. It was just a kind of a frustration that nothing is organized. That is why we started as a platform, and we started the first of the platform that was there to start discussing psychiatry. Okay, it started as a WhatsApp group, but now we have expanded. Now, keeping that thing away, let's move ahead. So, a bit about myself. So, this is me, Dr. Manish Roshan Thakur. I have done my MD from AIMS New Delhi, and we have Dr. Prachi also. She's also a pass out from AIMS New Delhi. She has also done her MD psychiatry from AIMS New Delhi. So both of us will be, we have this platform of our own that is called as Psych Reads, where we guide the residents. Now, when we look into the orientation proper, that is the PROM, the Psych Reads orientation module, first thing is, I just want to give a disclaimer that whatever we are discussing, it's the tip of the iceberg. Always remember that the sky is the limit. Now, before moving further, let's discuss some of the raw truth about psych residency. It is very exhaustive branch, first of all. So don't get into that notion that you have to work for a very few or a restrictive hour and then you are free to go. Remember, it is one of the exhaustive branch because it is very mentally exhausting. Mentally exhausting means even though you are not moving around quite a lot as compared to your peer residents who are there in medicine, orthopedics, obs gynae, who are moving around the hospital here and there, you'll feel that they are doing quite a lot of work. Still, you will find yourself that you you tend to drain quite fast. You do have that kind of exhaustion. Why? Because it is quite a difficult branch. It is not that easy. It is a very difficult branch. There are some things which make it very difficult. I'll not hide these facts from you. It's a difficult branch because first of all, you'll be exposed to very new, different uh, avenues of brain medicine. Not only that, you have to read psychology part, psychotherapy part, sociology part. So everything is very new to all of you. Now, after that, also you have to link and try to form a deeper concept in just 3 years. People who are reading medicine, they have the advantage because you have read medicine in your MBBS, you have read obs gynae in your MBBS, you have read orthopedics in your MBBS. But as far as psychiatry is concerned, you haven't read. All of us, we haven't read anything in our MBBS. Now, the second part is it is a very skill oriented branch. Skill oriented branch means, see, your clinical acumen and your skill does matter a lot more than your theoretical knowledge. Theory part does have an impact, but I'm saying that always and always remember that your clinical acumen, your clinical skills is something that will be of utmost importance after 3 years. If you're not good clinically, you'll not be able to manage the patient well. Not only the clinical skill, remember one more thing, that you have to read right from day one till the last day of your residency, even after that. Now, I'm not saying that you have to have a very, very detailed kind of schedule as far as your reading is concerned. Okay. Minimum, if I have mentioned over here, reading as a habit, minimum half an hour per day of reading. That will be sufficient for you. You might say that, okay, he is telling that he just half an hour is sufficient, but remember that even I'm just saying that 30 minutes is okay. Believe me, there will be days when you'll not be able to find even those 30 minutes because you are quite exhausted. You are either busy in your emergency, you are doing your ward work, so you might not be able to find that 30 minutes of your own peaceful reading hours. In MBBS, we have the luxury that in our internship, we can take out that time so that we can prepare for our NEET PG or INI exams. But in this residency, we might not be able to get that luxury time. Okay, now people do ask, what about the work-life balance? See, work-life balance, the topic itself is a big myth as far as residency is concerned. I'll be honest with you, it might sound it might be sounding very much rude, but work-life balance kind of a thing doesn't exist in residency. After residency, you can think about work-life balance, but during residency, you will never be able to find that kind of work-life balance. Why? Because no one will say this, but remember that any branch of medicine, any branch, no one is expecting you to go to your host, hostel or to your room by 9. Unless and until you have done your work, then only you will be allowed to go back to your hostel room or to your accommodation. Okay, so this is the raw truth. You have to accept it. Now, in the meantime, also you have to take care of your health. You have to take care of your food. So don't miss on your food. Don't skip meals. If you feel that you are skipping meals, remember you are bound to get some kind of illness. You will fall sick and you will be missing on quite a lot. So try to remain healthy. If you get time, sleep nicely. Please make a schedule so that you can sleep very nicely. Okay. Now, there will be days where you'll be definitely having difficulty in sleep also. Why? Because you'll not be able to find that proper hours for sleeping. Remember this. It is you. People might say that psychiatry is a very light branch. No, again, it takes quite a lot of time because single patient management takes quite in-depth understanding. Also, you need to go very deeply inside one patient to understand everything. So you need to work on one patient as compared to other peers of your medicine who are working on 10 patients. So 10 patient load of medicine is equal to one or two patients in psychiatry. So that kind of equation I'm talking about. Now, as far as learning is concerned, remember that some part of learning will be done as a junior resident. Okay, when you are a junior resident, you'll be learning some parts. and some parts also you'll be learning as a senior resident. So don't think that junior residency is just sufficient to completely understand psychiatry. Some part of psychiatry you'll be definitely understanding very well when you'll be doing your senior residency, because it will give a very different perspective. So don't feel disheartened. Don't have that kind of uh, a fear or a kind of a you know don't underestimate yourself that okay, I am not fully equipped, I don't know much. Even today when I read something, I am grasping something or the other which I was not aware of in past 5 years, so it doesn't make sense. It's okay, gradually things will come, but remember that GR, as a GR you need to know something, and as an SR you will definitely need to add on to that particular knowledge which you have learned as an GR. But remember that major part of your learning happens while you're doing your junior residency. As a senior resident, you'll be definitely learning more about management, more about handling the junior residents, how to run the department. As a GR, you'll be more equipped to do patient management, research. As an SR, also, you'll be doing your research, but learning will never stop. Okay, so don't think that the transition will be like the learning will be only in the GR ship. No, it will also happen in the SR ship. Okay, now since we have done this, let's look. So many people ask how a psychiatry resident should be. See, first of all, don't change yourself. Okay, don't at all change yourself. See, rather improve on your skills and your shortcomings. See, whenever you'll be joining your department, you'll be either having a group of people who will be ranging from 2 to 10. So if you are joining at a department which is a smaller department, you'll find two or three of your colleagues who are there, and some of the department have larger number of people. See, there are set of people who will be saying that you have to change yourself for psychiatry. Be what you are. Don't change yourself. Rather, try to recognize your shortcomings. That if you're not patient enough to listen to the patient, if you cannot sit for long, try to improve on those set of shortcomings. Try to learn from your colleagues also. There is a kind of a problem which happens when you join residency, that there is a kind of a competition which happens between all of your all of your batchmates, between your seniors and you and the junior batches. Try to get minimum into the politics of the department. Try to be as far as from politics as much as you can. Try to avoid all these kind of nonsense. Okay, try to improve your skills. If you are not good at one aspect, suppose you are not good in giving depot injection to the patient, or you don't know how to give injection to the patient, try to find a nursing staff or a colleague of your own or a senior of your own who can teach you how to give injection, rather than going away from that particular task. If you're not good at management of any of the known simple medical complication, don't avoid it. Try to learn it from your colleagues, because residency is the last step before you'll be landing in the real world. If you are going to do your clinical practice, or whenever you are going to become a senior resident, no one will be there to guide you. This is the last step where you should learn how to do everything so that you can help your patient. So please, please, please try to improve your skills and your shortcomings. If you have shortcomings, discuss with your colleagues, with your seniors, with us also, and get rid of it. Improve on this. Okay, don't have that kind of fear. Okay, now always be patient. Why? Because see, there are people who will feel that when they land up in MD residency, things are running very slowly. Okay, they have this expectation that everything will be going fast and fast, because NEET PG preparation, there are only MCQs. People do lot of multiple revisions and they think everything will be going in that same way. No, here again, remember that there will be a stasis that will come, and after that, you will be able to find that okay, psychiatry runs in a very different speed. It is having a speed of its own. It is slow initially, but later on, you'll find that more number of information you have to gulp inside. The patient management, it becomes tough because you are trying to manage some of the difficult patients. Okay, as a junior you might be able to manage the simple patients first, but as you become senior you will be handed over some of the difficult patient. Then again, remember, the burden will increase. So be patient, don't be in a hurry. Okay, don't be judgmental towards your patient. Whatever the patient be, even if the patient is of personality disorder, patient is of mood disorder or any kind of disorder, even if why not a kind of a person who is coming up with paraphilia. No, don't be judgmental. If you laugh, if you are judgmental, remember it is one of the shortcomings. So you need to improve on that particular skill. If you don't improve on that skill, you might not be considered as a good clinician. Next, improve your observational skill. This is one branch which requires great degree of observation. Right from the moment the person enters to the interview time. If you are done with your physical examination, well and good. But before that also, the moment how the person speak, how the person talk, how the person approaches towards your uh, like if you have asked a question, how does the person approach towards that particular question? What is his or her way of understanding? All of that matters. So your observation skill is something that you should work upon. Okay, this will be improved. Like you can improve on this if you are patient. So that is why you need to work on this. Most of us we lack this part, and this is one of the important things that we need to work upon. Now, see, leave your work in the wards once you are done. This is one of the golden things that I'll say, that the moment you are out of your ward, please don't talk about what is happening in the ward. We generally tend to do this, that okay, what was your case, how you have done the management, what was the difficulty, some or the other family members were creating some kind of nuisance or they were arguing with you. Try to leave all those things in the ward. Okay, you see, initially it will be very you will find it very fascinating to talk about all these things, but gradually it becomes really burdensome and it will make you very much like you will feel that you are getting too much fatigue very easily, because every now and then, right from start of the day to the end of the day, there is patient that is going on inside your head. So try to stop this discussion, rather find a hobby of your own before like after leaving the ward. Pursue that. If you want, you can read. If you want, you can definitely go outside. If you want, you can sleep. Do anything. Try to leave your work at the ward. Once you are done, don't talk about it. And always find time to relax a bit. Even if it is not possible to relax every week, try to find some time so that you can relax in a month also. Remember, there will be days when you will not be able to sleep properly. So try to complete all of your necessary requirements that is there for your body. Okay, keep yourself healthy so that you can survive those 3 years. Now, if you go into the residency, there is a hierarchy that you have to follow. First thing that comes is your clinical work. You cannot say no to this. So the clinical work is of utmost importance, be it your OPD, be it your ward, be it your follow-up OPD or follow-up cases. You have to give time to this. If you are not giving time to this, remember, as a resident, you are not doing justice to yourself, not to your patient. And then you will be scolded by the teachers or the faculty over there. Okay, so clinical work, you shouldn't be missing on any of the aspects. If you find difficulty, ask your peer, ask your seniors, ask your faculty regarding how to manage. Don't feel shy. Get out of that notion that what people will say, because remember, this is the last last course which you are doing, after which you'll be exposed to the real world scenario. So don't have that kind of fear. Get into that habit of asking legit questions and improving on yourself. After your clinical work, the thing that is of utmost importance is your thesis. Remember, you have to do your thesis so that you can complete it, your MD curriculum. Okay, it's the mandatory thing. You cannot avoid your thesis. So try to complete your thesis on time. Now, there will be some people in your college or in your institute who will be doing your thesis a bit early. Don't feel that you're lagging behind, but remember, the like before the end date you should be able to submit your thesis. Okay, now thesis, remember, most of the people say how to select topic for the thesis. Most of the times if you give any topic to your faculty, they'll say okay to it, but at the end of the day it is their choice, it is their will how they want to continue with your thesis. So mostly the topic is decided by the interest of the faculty with whom you are working with. So try to know the interest of your faculty, in which field they really want to work upon, in which field they really like to work, and then frame your uh, study accordingly. Okay, don't get into too much of here and there, otherwise you will not be feeling that my things are being taken care about. Remember, thesis is a mandatory requirement. It is first research thing that you're going to do in your life, with a proper guidance and everything. Okay, so try to do it along with your faculty. Mostly you will be able to find that their interest is of utmost importance. Okay, so you need to work upon that. Now, self study comes after your thesis. If you get time, do self study by articles, textbook, and presentation. After you are done with your self study, you have relaxation. You can do any work, like for example, you can watch movie, you can go for traveling, you can do cooking, you can read books, whatever. So this is a hierarchy that you should follow: clinical work, thesis, self study, then relaxation. Okay, now see, if you look your first year, or rather the 3 years of your residency, it is full of hairpins. It is not a straight road. It will be, some days will be smooth, some days will be really difficult, some days again will be smooth, some days will be really difficult. So you need to work upon how you are going to do your residency. Take one day at a time. Don't be in a hurry to complete everything on a single day, because that's not possible. There will be multiple challenges that will come. First thing first, let's start with what books that we require. The first important book that we require, these are the two books that we require. First is ICD 11 and DSM 5. Okay, DSM 5, TR is also there. You can go with either of them. So these are the two things that you require. Keep a copy of ICD 11 and DSM 5. Remember, ICD 11 doesn't come in a hard copy. You have to take a printout of it, or you can keep a PDF, either wise as you wish. Okay. Now see, focus on the rubric headings. Like for example, if there is neurodevelopmental disorder, you should know that, okay, in neurodevelopmental disorder, these are the list of disorder which comes. Always remember the codes and subcodes for schizophrenia, depression, BPAD, OCD, anxiety disorder, somatic symptom disorder, and stress related disorder. Remember this. Always, always, always you have to remember. Like for example, for schizophrenia, if the code is 6820, you should be able to recall whenever you are asked. So make a list on day one, keep a diary with you, write all the important codes in one page and try to revise it multiple times. By that, uh, like uh, like by the end of a week only, you'll be able to recall most of the codes. Okay, so like for example, I've given one example of schizophrenia. If you try to make a list of all of these which has been mentioned over here, most of your work will be done. Like you won't be screwed for not answering all these things. These are basic things that you need to answer. For child psychiatry, please read DSM 5 more than as compared to ICD 10 or ICD 11. Okay. Now, for DSM, in DSM 5, always it's a good thing to read for child psychiatry. And remember, focus on the duration that is given in DSM. Now, after these two things, I would like you to select one of the books. Whatever book you feel like, you can think and choose. It can be Tasman, it can be Oxford, it can be Kaplan and Sadok synopsis. Either of the three books you can choose, or you can choose two books and you can read whatever topic you feel like from either of them. So, but try to restrict your choices to one out of three, or if you want, you can take two out of three also. Okay, now these are the books that you need to read right from cover to cover. Okay, right. Please remember that if you're choosing either of these three books, you need to read it from cover to cover. Now, there is another book which is there, and people are quite afraid about that book. That is CTP, Kaplan and Sadok, Comprehensive Textbook of Psychiatry. This is that textbook. It's the latest version, 11th edition. Now, this book you don't have to read from cover to cover. You don't have to read from cover to cover. If you are interested, if you really want to read, you can read these important headings from these books. Okay. Neurocognitive disorders, mood disorder, schizophrenia, dissociative parts of neural sciences or the basic neurosciences. If you want to read everything individually, we can definitely have a look. Like, for example, in neuroanatomy, you cannot miss on reading the neuroanatomy of basal ganglia, thalamus, hypothalamus, limbic system, Papez circuit, amygdala, lobes of brain, reward circuit. This is the bare minimum that you need to know. If you have time, you can read it from CTP. If you have time, you can read it from Snell also. Nobody will say that from where you have read. If you can quote your source, like if you can say that I have read it from Snell, that is also a well accepted, you know, reference. It's a very good textbook to read. Okay, but you need to know these basic things. Without this, at times you will feel that okay, you are not able to connect the dots if you're reading the neurobiology. Okay, now see, many people will say, what about the PPTs that has been shared in this aspect? See, try to avoid PPT. There are thousands of PPT. How many of them are you going to read and how many of them are you able to recall? That is really difficult. So try to avoid PPT because first of all, they are not in a sequence. They lack sequence and there is no referencing. That is the problem. And you don't know the source who has made this. If you have made a PPT, I would say read it. If your colleague has made a PPT, I would say read it. If some faculty is sharing a PPT, if that faculty has made it, read it, but also see that there it should be having a sequence and it should be referenced, then only you should be reading it. Else there is no benefit in reading PPT. No, because that doesn't build your concepts. Remember, this is not your NEET PG. This is not MBBS. This is not NEET PG exam. This is not MBBS. You have to know your basics. You have to develop that concepts. Okay, because this was just to pass your exams and land up in MD. Now you are in your MD, so you don't need to work, do the same thing that you have done in your internship or post internship. Avoid mugging up. Try to develop concepts. Okay. And remember that psychiatry is not black and white. It's the biggest mistake that you can find, that people will say it's quite boring. Reading books is quite boring. I'll give an example. See, if I have to read temporal lobe, what I'll do, I'll definitely look into the basic neuroanatomy. What are the boundaries of temporal lobe? See, either I can read it from an article or from Snell or from CTP, whatever I would like to do. Next, what I'll do, I'll definitely look into the important regions of the temporal lobe. What are their functions? Okay, if there is something that I need to know, I'll draw a simple line diagram also. Okay, and try to read this neuroimaging. Don't avoid MRI, CT, PET, SPECT, anything. Try to correlate anything that you read through neuroimaging, specifically the neuroanatomy part. Like if I have covered this, see, I have tried to label everything what is there. Now, some important syndromes you'll be able to find that okay, if I'm reading something about neuroanatomy, I have to read some of the important syndromes. So like for example, here is Kluver-Bucy syndrome. We had read this in our MBBS, but that is not sufficient. We had just read it, okay, who were the like what are the key features of a person, or sorry, a monkey who is having Kluver-Bucy syndrome. Okay, but that is not only required. You need to know the management, you need to know how it happens. So you have to read some things in depth. If a particular topic, like for example, Kluver-Bucy syndrome, you won't find it in your CTP. You won't find it in Snell. Snell, it has mentioned in clinical pearls. So don't worry. You have to go for searching. You have to search for your article. You can do it in PubMed. Like for example, here I have placed the reference. It's okay if it is not in your textbook. Not everything is given in your textbook. At times you have to search, take a printout of that article, or you can do like most of the people use iPad. You can place it in your iPad. You can read it. You can take screenshots of important article. You can place it in one place and make a note of it. But remember that not everything you'll be able to find in your textbook. So if you're not finding your topic in your textbook, don't worry. Go to PubMed, go to Scopus, go to Web of Science, and try to get that article and read it. Okay. Now, like I had this habit of taking a printout of it. So I used to take printout, read it, and then keep it in a file. You can do the same. Now, neurochemistry. This is of utmost importance. You can read neurotransmitter, and one organelle that you cannot miss is mitochondria. Neurotransmitters can be read from CTP. It can be read from your Tasman, or if you want, you can read it from Lippincott also. Nobody will say anything if you quote Lippincott as your reference. It is a very good book to read neurotransmitters, or if you want to read this organelle from Lippincott. But if you want, you can read it from these two sources also. Okay, like for example, see, if I am reading neurotransmitter, I need to know the definitions. I cannot miss on definitions. That is why I have placed all the definitions over here, and I have taken it from CTP 11th edition and Lippincott. So both the references I'm using. See, what are neuromodulators? You'll find that there are some important new terms that you are like once you start reading your textbook, you'll find that there are multiple new terms that are coming up. So you need to know the differences, why a term is given and why and how you can differentiate it from the usual common term. Like for example, neurotransmitter, you are hearing this since your MBBS. Neuromodulators, some people must have heard it in their MBBS days, but if you're not aware about this, try to understand what is this and try to differentiate it from how it is different from neurotransmitters. Now, suppose I'm reading acetylcholine. Okay, you can read about this in your CTP. It has given, like, it has been given in good amount of depth. Okay, like for example, these are the brain regions which are covered in acetylcholine, which have the inputs, or like for example, this is the region which synthesizes acetylcholine. This is another region which synthesizes acetylcholine. And from here, you can see that it goes to the different regions of the brain. Okay, try to keep as many pictures as possible. Like for me, it's easy to recall this picture rather than writing all of these in points. Okay, so again, this is what we have been doing in our MBBS also, that okay, this is the region which synthesizes acetylcholine. Okay, and these are the projections. What extra that we need to do? Okay, include the receptors here only. Not only this, this is all you have read in your this pharmacology or biochemistry. Important thing is this: acetylcholine dysfunction in major psychiatric disorder. So you have to know how a neurotransmitter is associated with every psychiatric disorder. Like for example, neuroanatomy. If a lesion happens in the brain in that particular region, what specific syndrome or what specific symptom can occur? Similar to that, you have to understand that okay, if I'm reading acetylcholine, is it only applicable for mood disorder? Is it only applicable for schizophrenia? It is only applicable for this Alzheimer or something else? And if it is applicable, how it is playing its role? That is what I have tried to give you an example. Like if I'm reading about major depressive disorder, we need to know, okay, these are the abnormalities that happens and these are the symptoms which happens because of this abnormality. If you try to read neurotransmitters like this, believe me, when you are giving your medication or how and when you're trying to improve the symptoms of your patient, you will be able to understand, okay, this is the reason why this medication is working in this particular patient, because something is happening at the level of neurotransmitter, or the medicine is going and acting on that particular receptor. Okay, so this up till here you have read it in your MBBS. What you need to add on is this: how it is impacting in the pathogenesis of psychiatric disorders. Okay, so this is addition part. Now, next, remember when I mentioned regarding Kaplan and Sadok CTP, I said that you can read on some of the important segments which are there in CTP. You don't have to read CTP from cover to cover. Okay, so Get out of this notion that you have to read from cover to cover. People who say they have read CTP from cover to cover, good, but is it really helpful? Not really. Okay. Now, see, if you want, you can read all of these. Remember when I was mentioning neurotransmitters? See, neurotransmitters have been given in detail in CTP. So these are the chapters that you can read from CTP, the big book, directly. Unit 1. If you want, these two important chapters are also there, diagnosis and treatment, which you can read from CTP. Next, delirium, dementia, amnestic syndromes. It's a very good, these are very good chapters that has been written in CTP. You can read this. One important unit that you cannot miss upon, it is psychosis or schizophrenia. This you have to read. It's a must thing that you have to read from CTP. Schizophrenia, you have to read each and every chapter. That is why you can see 2, 4, 5, 6, 7, 8, 9, 10, 11, 13, 15, 17. So most of the chapters I have mentioned that, okay, you have to read this from CTP. Next thing that you have to read is mood disorders, anxiety disorder. Remember, OCD is very poorly written in CTP. That is why I have not mentioned OCD over here. Okay. Factitious dissociative disorder, very well written. And psychosomatic medicine, you can read over here. Suicide again is very well written in CTP and ethics in psychiatry. So if you want to read CTP, you can go with these important essential chapters first. Then if you have time, you can read the other units also. But I'll say that if you want, please go through these headings first. Next, another important thing that we lack in our MBBS days. This is note making. Now see, if you try to make notes, well and good. There is an art to make notes because the notes should be helpful for you in building your concepts. Number one, easy to recall. And number three, it should be sufficient so that you can write it in your answers when you are asked in your exams. Either it is the semester, the end semester exam, mid semester exam, or in your MD exams. You should be able to make notes such that all of these three purpose is getting fulfilled. If you're not able to do so, the whole time that you're making your notes, it is going to be null and void. That doesn't count. Okay, now see, if you're trying to make notes, try to write the definition from either of the textbook or any of these sources. Try to have the reference, write the ICD code, write the epidemiology. And if you're reading epidemiology for foreign or worldwide, you can use CTP as the reference. For India, you have to use National Mental Health Survey, which was conducted by NIMHANS. For Indian data, you have to focus on this. Right from day one, please start reading these important data. Okay, you have to incorporate in your note making. If you make this notes like this, believe me, you'll be able to clear your concepts. You'll be able to write in your final MD exams also. After you are done with the basic heading, write the diagnostic criteria. For child, please prefer DSM-5 over ICD 10 or 11. But for rest all, please prefer ICD 10, 11, then DSM-5. After this, focus on clinical features. Now, after clinical features, focus on this neurobiology. This is one important aspect which we are weak. If you are well versed with your neuroanatomy, neurochemistry, neurophysiology, it will be really a piece of cake, nothing else. Next, the heading is differential diagnosis, management, non-pharmacological and pharmacological. Remember, when you're writing management, you have to use guidelines. I'll show you what are the guidelines that you need to focus upon. So don't worry about that. So your management should be according to your guideline. Indian guidelines is of utmost importance, but one important guideline that you should know is NICE guideline. So this is how you should make notes. If your note is according to a particular sequence that I have mentioned over here, even if someone asks, suppose someone asked you to write about, okay, this schizophrenia. So you can write the definition according to CTP, that what is schizophrenia. You can write the ICD code that it has been described in 6820 in ICD 11. What is the epidemiology? You can mention the data that is given in CTP and National Mental Health Survey, that is the data for Indian population. You can write the diagnostic criteria according to ICD 11. Then you can come with neurobiology, differential diagnosis, and management. In management, you have to write Indian guidelines as well as the foreign guideline, that is NICE guideline. Most commonly, we follow the NICE or the Maudsley guideline. Okay, I'll just show you one of the example. Like suppose if I'm reading neurobiology, what I should do, I should be able to know the neuroanatomy first, that these are the regions of the brain which are affected in psychosis or schizophrenia. Then what are the important things that you have to note for schizophrenia? Okay, these are the important changes that happens in development of psychosis or schizophrenia. Now, after this, what I should do, this is what we have read in our MBBS also, that these are the pathways which are implicated in schizophrenia. Then try to make a diagram of it, or try to get a diagram of it. Okay, once you are done with this, next look into what leads to positive symptoms, negative symptoms, cognitive symptoms. Don't worry, I'll share this whole document with all of you. So this will be there with you. So don't worry, just listen properly. Now here, if suppose I'm writing about positive symptoms, see mesolimbic pathways involved, neurochemical basis, and what is the functional impact. So if you read like this, nothing will be a problem. Okay. Now, see, all the important things has been incorporated. So neurobiology is done. Next important book that you have to read is Maudsley. Maudsley is a prescriber guideline. It is being released by Maudsley Hospital. Most of the guidelines are similar to what you read is similar to what has been mentioned in NICE. So mostly it is similar. I'll not say that it is exactly the same, because somewhere or the other you'll find that Maudsley it's a bit different from NICE, but almost it is the same. Now, if you ask me which topic or unit to be read from this particular book, schizophrenia, you have to read the NICE guideline. Read about LAI and depot. It has been given in great depth in this textbook. Read about refractory schizophrenia and clozapine from Maudsley. Remember, TRS or treatment resistant schizophrenia is not given in CTP. It is given in Maudsley. Bipolar disorder, cover lithium, valproate, carbamazepine. Then go for the guidelines for treatment of acute mania, hypomania, rapid cycling, bipolar depression, and prophylaxis of BPAD. All from this textbook. For depression, nice guideline you have to read. It is very well written over here. Treatment of resistant depression, switching antidepressants, and antidepressant withdrawal syndrome. All has been mentioned over here. Next, in addiction, these two are of utmost importance. Okay, now moving ahead, child and adolescent, you need to read the guidelines for these three important disorders: ADHD, tics, and Tourette from Maudsley. Now, older people need to read dementia, how to manage dementia, and behavioral and psychological symptoms of dementia, which is also called as BPSD. Pregnancy, again, you will have all of the data from Maudsley, which drug to give, which drug not to give, which drug to avoid. Okay, and if you are giving a particular drug, what can happen? So it is very well written over here. Hepatic and renal impairment also has been mentioned over here. Okay, now next is there anything more that we need to know? Yes, in CL Psychiatry, this is the consultation license psychiatry. So consultation license psychiatry, there is a handbook of consultation license psychiatry which is released by AIMS. Okay, I'll provide the PDF with you. You need to read this book, specifically these three topics. And for substance, you can read CTP, you can read synopsis. If you have time, you can read Lovinson and Ruiz. Okay. If you are reading this book, I'll say please read these three topics from this particular book. But remember, the management of substance you have to read according to the Indian guidelines. Management of substance use disorder according to Indian guidelines. Okay, next. Like suppose if I have to read cannabis use disorder, this is just the introduction that I'm giving. First, I should look into okay how cannabis is extracted? What is the source? So this is the source that I should know. Similarly, you need to know the source of alcohol, you need to know the source of opioid, you need to know the source of any of the agents that you are reading about. Once I'm done with the source, let's look a bit about the history. Done. These are the various ways in which cannabis can be consumed. Now, you have to know about the pharmacology of each agent. Alcohol, how it impacts, how it acts on our body. What is the pharmacokinetics and pharmacodynamics of alcohol? Pharmacokinetics, pharmacodynamics of opioid. Pharmacokinetics, pharmacodynamics of cannabis. See, you have to read all of them. Now, after you are done, you'll find that okay, there are some new things. Like for example, opioid receptor, we have read it in our MBBS days, but cannabinoid receptor, we usually tend to read quite less. Even if we are reading, we are just reading for the MCQ sake. So you need to know a bit in depth. So again, suppose I'm these are the notes that is there in our module, but I'm just sharing it with you so that okay, if you have to read, this is how you can read upon this. Now, important is mechanism of action. See, you can see that psychiatry is not black and white, it is full of colors. The important thing is you have to realize that it has to be read in a particular way, it has to be read in a sequential manner. Now, once you're done with this, good, you can come down, you can see how the signaling happens and what are the impacts of cannabinoid receptors. It is not only the brain which is impacted, it's the whole body which is getting impacted. Just an overview. Okay, so this is the pharmacokinetics that I have mentioned about. Okay, now, okay, then you have to read what are the intoxication features, what are the features of withdrawal, what are the features of chronic use. See, withdrawal manage the signs and symptoms of withdrawal. This particular chart has been taken from that textbook Lovinson and Ruiz. Okay, and also see, whenever required, we can take the help of our important articles. Okay. Now, next important thing is, which is hardly being covered anywhere, is community psychiatry. For community psychiatry, there are two things that you need to keep. One is this book by Dr. B.S. Chavan sir, and one is a handbook that is released by Nimhans. You need to have both of them. Now, even after having both of them, if you don't have time, don't read it from cover to cover. What you have to read, all the important things I have mentioned over here. You can read these topics from these two books. You can make the notes accordingly. No issues. Next, important trials. There will be multiple trials which will be asked in your final MD exams. But what is happening is we are not aware about these set of trials or these set of studies which has been done during our first years, second years. Usually in our last semester, we are aware, like we are told that you have to read around 5 to 10 different trials. Then we are in the panic situation that how we'll be able to read all of these. So make it a habit to read it right from your early part of your residency. Like all the important trials which is usually being asked has been mentioned over here. What you have to read, you don't have to read everything about each trial. You have to read the year, when it was done, where it was done, and approx number of patient. Like suppose if in KT Cutlass there was like for example in any of the trials, suppose the number is 3612. You don't remember all of these. You should remember that it was around 3500 or less than 4000. You can remember in ranges. No one will say that you don't know this. If you even if you give an approx number, people will be happy enough that okay, you have read it and you know something about it. You have to know about the modalities. What were the arms in which these trials were conducted? Like the arm number one was what? Whether it was placebo, whether some active agent was given, arm number two, any other agent was given. So you have to read about that. Important outcomes, not all the outcomes, but the important outcomes. Focus, see, more than the percentage, you have to focus on the outcome and the key features of each trial. So hardly each of the trial you have to remember 10 points. 10 points for each of the trial, not more than that. Keep it a like make it a habit that you have to read these trials. Like suppose KT Cutlass ESOP, this you have to read along with your schizophrenia. Star D Step BD Boulder 1 Embolden Balance, this you have to read with bipolar disorder. MTA, TAD, Stodia, PODS, this is for child psychiatry. Very easy. If you try to make it in bits and pieces, you'll be able to understand and learn it. Next, laws in psychiatry, very important. Forensic and laws. These are the list of laws that you have to read. Like suppose if I take this example, POXO. Now, if I have to read POXO, I need to know about when it was released. We'll just see an example. So these are the laws, important laws. These are the important things that you have to read in forensic psychiatry. If you want to know which book to read, you can read the books. Book is by R.C. Jiloha sir. I'll share the PDF. This is a forensic psychiatry book. And the next is, if you want, it's a Nimhan's forensic psychiatry booklet. So from these two sources, you can take the help. Now, suppose if I have to read POXO, I need to know when it was released, what are the chapters, section, and what is the definition of child according to POXO. Next, what are the important sections? See, and what are the offenses that has been mentioned in this particular act? Punishment, where it has been mentioned, and what is the punishment? If you know this, more than enough. Now, you have to know the definitions of each of these offenses. That is what has been written. Don't think that it is overwhelming, it is becoming overwhelming, because this you have to read over a span of 3 years. So don't worry that you have to read everything in one single day. But if you know what to read, you can definitely plan how to read in later half. Now, suppose I have read all of these things, then I need to compile also. So the compilation can be done in this format, that at one place, write all the offenses, the description of punishment, and the punishment, what is being mentioned in the act, and any special thing that has been mentioned also. Try to write in one single flow. Okay. Now, this is another example. Like suppose if you're reading Juvenile Justice Act, very important act. Again, what I'll do right when it was introduced, what are the chapters, the sections, why it came into the picture, and what are the important sections and punishments. Similar to what I have written for POXO, I have done it for JJ Act also. So that will be easy for you. Keep a kind of a similarity with all the acts. Okay, now important studies in psychiatry. These are the list of important studies that you'll be asked in your Viva exams or even in your theory exams. Very less likely in theory, but more commonly in your Viva exams. IPSS, DOSMED, ISOS, SOFACOS, and Madras Longitudinal Study. This is for psychosis that you have to read. For Bitcoin, this you have to read for your bipolar disorder. National Mental Health Survey. This is this thing that you have to read for your epidemiology in India. This is for the Indian data. World Mental Health Survey. Again, you have to read this for your epidemiology for worldwide. You can read the CTP also. AIMS, Magnitude of Substance Use Study. You have to read this for epidemiology of substance use disorder in India. Remember this. Okay, next. Remember, I was talking about the guidelines. For all the disorder, you need to know both the IPS and the NICE guidelines or the Maudsley guideline. For mood disorder, you need to know NICE, IPS, and CanMate. If you know these three, good to go. For gender dysphoria, you need to know WPATH guidelines. For OCD, IPS is self-sufficient. Two important things that you need to know apart from these disorders. This is the guidelines for the drugs. Like for example, clozapine, you need to know guidelines that is according to the UK and the US because both the guidelines are different. Similarly, you should know guidelines how to initiate, how to stop, how to monitor the mood stabilizers according to IPS and NICE. Okay, now, like suppose if I have to read bipolar disorder, this is the guideline that we have to read. So like this is a document that I have prepared. See what is over here. I have included CanMet, I have included NICE, I have included RANZEP, okay, and British Association of Psychopharmacology. Now, like this acute mania. So I'll be looking what is the first line, next intervention, later intervention. So this is the Korean guideline. I might not require this. So we can avoid this. Next is British Psychopharmacological Society. This guideline might be requiring. So first step, second step, and the next step. This is how we can remember. Similarly for CanMat, we need to know for this is for acute mania that we are covering. Okay, nice guideline. See what they are mentioning. This is according to Maudsley also. This is the same thing that they have mentioned. Once we are done with acute mania, see the maintenance guideline is different. Again, all the guidelines have been compiled over here. Now see, if you try to read different guidelines, it will be totally, it will become chaos. You won't be able to organize them and you won't be able to write them when you are asked. If you try to organize them in a particular order, you'll be able to read around 2 to 3 guidelines. You'll find that there is similarity between multiple guidelines. So that will be easy. So this way you'll be easily able to compile all the guidelines. Okay. Now, this is for rapid cycling. Okay. Done. For neuropsychiatry, you can do either of the textbooks. Neuropsychiatry, you can also read CTP also. So if you're taking neuropsychiatry, you can do with CTP. Remember in synopsis, there is one drawback of synopsis that neuropsych chapters are not mentioned in synopsis. So either you have to go for Oxford or you can go for CTP. These are the important things that is there for you to read for from neuropsychiatry. Now, apart from this, you need to keep the CPG IPS guidelines. These are available in Indian Psychiatric Society website. Okay, you can log in and you can download it there. Okay, now because if you don't have time to read any book, even if you read the CPG guideline, it will be sufficient for you to recall around 60% of this stuff, and you can write them in your exams also. Don't make it a habit to read from only from the CPG guidelines. Keep them as a rescue thing. You need to know them, but these are not the only things that you should be knowing. Try to read from textbooks. Okay. Coming to psychology, you can choose any of the textbook. Morgan King, this is Barron, this is Wayne Wheaton. Okay, you can also use Atkinson. Okay, whatever you want, you can read. I have read this book. So this is a very beautiful book, full of illustration, full of example. Okay, some my friend, he used to read this book. Okay, no issues. The important thing is this. You should be well versed with all of these topics. Either you read from any of the textbook, it doesn't matter. The important thing is you should be knowing these topics. You cannot miss on these topics. These are the topics which you'll be able to find that all over India. These are the topics which are being asked from psychology. There will be some topics which will be not mentioned over here because see, one or two odd topics can be asked in some parts of the colleges, some part of Indian, like there are multiple colleges over there. They can ask one or two different topics, but overall, these are the important common topics which you will find in any of the college question paper. So for psychology, you cannot miss on any of these. Okay. For therapy, one good book is Keith Horton. This book, easy to read, easy to apply to the patient. All the steps has been mentioned. Good book to understand CBT for any of the disorder. CBT for anxiety, depression, OCD, even if you have to do psychoeducation for sexual disorders, very good book. Keith Horton is a very good book for all the beginners. I have also read it because it was easy for me to apply these concepts and to understand the concepts and also to apply to the patients. If you want, you can definitely read this textbook for CBT by Beck. And remember that if you want, you can read Wilberg. If you have too much of interest, you can read Wilberg for psychotherapy. But since it is a very thick book, you might not be having that much time. Try to restrict your discussion from these two. And also, CTP also mentions regarding various kind, sorry, synopsis, sorry, synopsis also. mentions a lot about psychotherapy. So you can read from these sources. Most important ones that you need to know is CBT, basics about DBT, supportive psychotherapy, then you should be knowing about IPSRT, interpersonal social rhythm therapy. Last of the thing is biostats. Remember, there will be some important things that you have already read. Like, for example, mean, median, mode you have read in MBBS. Sampling techniques, Bradford Hill criteria, test errors, but number needed to treat, LHH, meta-analysis and systematic review, how to conduct analysis, factor analysis, regression analysis. You all have to read. You can either read it from your Mahajan textbook or from articles in PubMed. Directly write about these topics. You can download the articles from PubMed. Okay. Now, in neurology, either of the three will be helpful. Few topics you have to read from neurology. These are those things: seizure, Parkinson, Guillain-Barré, multiple sclerosis, stroke, movement disorder. People will say that you need to read all of them, but if you ask me the important ones, these are the six important ones which you need to know: the management, the symptoms, and everything. You can choose any one of them. Okay, you can choose any one of these books. Bradley, Adam, Harrison. I read Harrison because I have read it in my MBBS, so I read it once again. But I found it that this textbook is better than Harrison because it is having a more in-depth approach. So I started reading Adams later on. Only these 4 or 5 chapters that will be sufficient. Now, in psychopharmacology, you will be having options to read Stall. Fifth edition is there. You can read Stall. But remember that for individual drugs, Stall is not that sufficient. Okay. Now, one book that I would like you to go keep a PDF of it. If you don't have the hard copy, you can keep a PDF of this textbook. APA textbook of psychopharmacology, 6th edition. Here, individual drugs, like if you want to read about venlafaxine, if you want to read about escitalopram, if you want to read about sertraline, you can go with this textbook. Like for example, this is one of the agents that I have just taught, sertraline. Now, if you want to read about sertraline, it is the same way that we have read in our MBBS. Pharmacokinetics, need to know about pharmacokinetics, need to know about pharmacodynamics. Remember that we are not reading the MBBS curriculum, or not, or neither we are preparing for NEET PG. So mostly what happens is receptor level we would be reading in our MBBS days. Neurotransmitter level also will be reading. But after that, you need to know the cellular, epigenetic, and genetic level. Okay, so as a resident, you should be reading psychopharmacology in depth. Like suppose what happens when we take sertraline for long. These are the changes that happens in the cells. So we need to know that how changes are happening in the cell. Okay, like this is a summary of all the important things that are being done by sertraline to a neuron. Okay, now all the indications you need to know, keep it in a sequence. Okay, the important interactions. And again, I am focusing on this. As a resident, you should know in what formulation the drug is available in the market, in what dosage, or in what, uh, like for example, here you can see sertraline comes in 50 mg and 100 mg tablets. You might be asked about all these things. So whatever drug you are reading, you need to keep a check on all the important dosage that is there. It is available in the Indian market. Okay. Don't find that India Mart is having all those dosage, because most of the things which is there, try to, you can find it in 1 mg site also. What is the dosage? But you need to know according to what is there in Indian market. Okay. Now, after that, I would just like to say this is the oldest of the updates handle, the Psych update handle. You can spend around 5 minutes to read two posts. Around 584 posts are there. We have covered schiz, bipolar disorder, OCD, anxiety. This all thing has been covered from CTP. So if you want, you can go to the first post and you can start reading about schiz. So it's a free source that you can read about all of these from Instagram. Okay, this is the only page which is available in India where you can read all of these things without any charges. Now, remember, after going through all of these, first of all, don't be panic. Don't be in a panic situation. MD residency is to become creative. Thinking out of box is something that you should know. Remember, learning is a stepwise and an active process. You have to plan accordingly. Next, you need to find time to relax, build up strategy, how you would be how you would be shaping your career in the future, how and what do you want from your residency. Remember, residency brings out a new identity of yourself and changes your outlook. This is by changing your deficiencies and your problems, and as a result of which you will be a better person after you are done with your residency. Okay, fine. Now I would just take out time to discuss about case reports. Case reports and presentation, something that you will be asked to do in your residency. Like suppose I have just, I'll just show one of the case report. This was one of the case reports that I've done with my colleagues. Okay. Now you can see that, right, it was just a simple case, but again, it is less being reported. So be vigilant about whatever case that you are taking. A simple case which might be of least importance to anyone, but if it is of you know it is something very interesting, it is something very fascinating, you can report it, you can see, go to PubMed, go to Scopus, go to Web of Science, look for whether these set of cases has been reported or not, or if there are less number of cases you have reported, what you can do, you can write a case report and a review of literature. Okay, so this was released in 2024. Now you can see that I have compiled our case over here in form of case summary. Not only that, we included all the cases that has been mentioned right from 1988 till date. So ours was the 20th case that is there for methamphetamine induced psychosis. So this is not a bad thing to do. Okay, and this is not a hard thing to do. You just have to be vigilant, ask your senior residents so that they can help to formulate your case report and try to submit it to journal right from, after your 6 months or the after a year of your residency. Once you are done, you can keep a track of your cases, which is very fascinating, which is very interesting, and try to submit it into journal. You can present it into in various conferences which are there all over India, which is going on. So you can do that also. Okay. Now, before I take the next section, I'll just look into some of the questions which are there. Okay, from where to start studying? As soon as I see case, I will try to find it in Fish or Sims. Seems like jumping between the books. Now, this is why I have kept this discussion over here. Apart from what I have mentioned in the books, you need to understand that psychopathology, you need to read Fish first, cover to cover. Then you can go to Sims. Some people read Sims first, that is their choice, no issue. Both of these textbook has to be read from cover to cover. Now suppose if you get a case, since you are in your first year, you will be asked regarding psychopathology. So it's better that in your first 6 months to 8 months, try to cover 4 books. ICD, DSM, that is one. Number two is your Fish. Number three is your Sims. and number 4 is your stall. Try to complete this first. And if you have time, or if you find that okay, you can cover something else, what you can do, you can start reading synopsis along with this. So apart from this, you can read synopsis also. Or if you want, you can read Tasman or Oxford, whatever you find that it is of your like. I find Tasman really nice. So I like Tasman. But if you're finding Oxford is easy for you, you can read from Oxford. Okay. So don't feel like jumping between the books. First 6 to 8 months, give yourself some time. You might be scolded that you're not answering accordingly. But remember, try to finish these two books as soon as possible and then start reading stall gradually. Keep ICD and DSM always in your bag or do always carry. So whenever a senior is taking a case or you are taking a case or you are assisting your seniors, you open up when the when he or she says any diagnosis, try to read all the criteria that has been mentioned over there. By that, you will be able to, it will get inside you. You don't have to mug up. Okay. But keep a diary and whatever important diagnosis that I've mentioned in right in the beginning, write the codes from ICD-11. Okay, that will be easy for you because most of the faculty or teachers they definitely they have this habit of asking these codes. Okay, now how to learn to be non-judgmental when patient tells his or her problem. I think my personal bias shows up on my face. How do I change that? So this is very important question. That is why it has been said that you try to listen to the patient. The moment you are done with your work, don't try to carry it back to your home. Okay, this will come gradually. First of the case, if you are looking, you might be able to correlate all of your problems along with that patient. This is what you have to learn in these 3 years. How? See, being non-judgmental is like suppose a person has committed some kind of a sin which is according to you it's a very bad thing, but it is just a patient who is there in front of you. You don't have to be, you know, legally, socially correct. You just have to look into the problem what the patient is having, jot it down, write it down, make a diagnosis, do the management. That's it. See, most of us we do have this habit whenever we land up in psychiatry that we'll be reading minds of other people, will be changing the society, will be changing the person from will be changing according to what I feel is correct. Nothing happens like that. Be realistic. You have to manage the patient, you have to take care of the patient, make him or her better. That is what the goal is. So don't try to associate your problems with him or her. You might find there is a big amount of similarities in the situation. Okay, but if you try to correlate everything, what will happen? You won't be able to devote time for case management. You won't be able to read also because every time you'll be thinking about those set of problems. Discuss it with your seniors and with your colleagues that okay, I had similar kind of situation. I'm finding it difficult. They might also come and take history with you. They might also come and talk to the patient. Or what you try to do is avoid all the conflicting things that is there, which is common between you and the patient. Suppose it is of not importance to the case. You can try to avoid all those kind of scenarios or discussion. But if it is important, you might need help from other people also. So be open that I'm finding it difficult because I had a similar kind of scenario. So anyone would like to help me in this particular case. Try to ask. Personal bias will come. Personal bias will come. That is why 3 years is there for residency. You cannot do it in 1 year. I also had the same problem, but later on I realized that okay, I don't have to be too much emotional. I know that there are challenges in the society, but this is the best that I can do for this person is to get the functional like to improve the functionality as much as I can do with the help of drug, with the help of therapy and rehabilitation. That is it. Okay. Does SpsychRead app allow two login at a time? So it is just like Netflix, my dear. Okay, you can log in on as many devices, it will work in only one of them. Sir, what about learning aspects which are left, which uh, will be left behind other subjects. Rohan, what is your question? Can you just let me know once? Earning aspect, sir, as compared to, are you saying respect or aspects? Okay, earning in psych. Okay, so you are talking about money. Am I right? You're talking about money? Rohan, is it okay? You're talking about money? Okay, fine. So let's be very honest. See, you'll be earning mostly through your OPDs, some interventions that you can do. Okay. Now, there are a set of people who do their OPD in city, and side by side they also go to a suburb, like 2 to 3 times per month. And in city they'll be doing daily practice. Okay. Remember, growth in psychiatry is slow. It will take around 2 years to settle down. There are people who are having their kind of a backing from the family. If you don't have that kind of leverage, don't worry. 1 to 2 years you have to struggle. Any branch. My seniors from AIMS who have done DM cardiology, they are not able to practice in South Delhi. They have to go to Faridabad, they have to go to places in Haryana where they can practice. It's not a big deal. Even if you start your practice right in one of the posh region of your city, it will take around 1 to 2 years so that the flow can increase. So don't worry about that, because you need to look into the aspect of psychiatry. Because suppose if I'm going to a psychiatrist and if that person is able to deal with my problem, why would I change the psychiatrist? First of all. Second, only if I am not getting result, I will come to a newer one. Now, this notion is there, if a new psychiatrist is there in the market, or he or she is there, they might not be able to grasp the problem because they are not well experienced. Okay, now apart from this, you don't have to worry, because the earning after 1 to 2 years, it will be an average earning sufficient for you to maintain your family. You can meet the needs of your family. If you are in a second tier city, it will be, the time will be less. If you are in a metro, if you are from Rewadi, good. Not many psychiatrists are there. You can do your OPD over there. Okay. If you're from Haryana, you can do your OPD. Even in Tamil Nadu, if you go to remote places, if you're well versed with those people over there, you can do your OPD. So what you can do is, like, you can do your OPD one in city, one you can do in your suburb kind of a region. Okay. In villages or something like that. If you want, later on you can discontinue this, and once your practice is there, you can continue with this one. Try to get around, if not possible, 1 or 2 new cases per week. That will be sufficient in the initial days, because you have to gain that kind of respect from like other colleagues also, like, that this person is responsible enough to get that. Okay, that amount of care which I am expecting, this person is able to provide. So unless and until you have that kind of notion from other people also, you might not be able to have that kind of a full flourished kind of practice. So it will, the growth is slow, that is for true. But remember that it is not bad. Most of the people or the private psychiatrists, most of them, they are doing fantastic. Even if you are doing your in a corporate setup, negotiate well with the money. Try to be at par with what they are giving or paying to the medicine or other anesthesia people. Don't settle for less. In corporate, you have to negotiate pretty well. That you'll be looking into cases in ICU. You'll be serving as a doctor in emergency. You'll be looking for the wards and the OPD also. So don't settle for less. In corporate, you have to deal very nicely with the HR. That is what one thing that I would like to say with a little bit of experience of mine working in a corporate setup. Okay. So try to negotiate well and give chances or explain everything, that okay, why you should pay me more or at par with my colleagues. Don't pay me less. Fine. How to use the Psychiatry app? Okay, so if you go to our app is like why we have framed this app because of the frustration and because I wanted to give in-depth understanding. That is why I have framed this app. You can choose any of the courses. There are three basic courses. Final Strike 1.0, that is for 27 months, 26, 7 months. Sorry, that is for 1 year or 14 months. Final Strike 2.0 is for 2 years. Final Strike 3.0 is for 3 years. So we try to cover everything. We try to cover psychopathology from fish, sims. Okay, like you can see, fish already we have covered. Stall APA textbook, psychology from Wayne Wheaton, and all of the psychiatry from the important textbook that we have written. We have covered all the guidelines from Maudsley and addiction psychiatry module. We have covered in depth, not only from Levinson, from ISAM, from ASAM, these textbook, and all our modules, they have the referencing done from recent articles. So you can use this. Okay, I'll ask you to go to download the Psychiatry app. Once you download the Psychiatry app, you can see some of our lectures for free, enroll for free, look into the lectures. Once you are done with that, you can opt for subscription. No issues. There are other apps also, but why, like since I am involved with this, I'll say why it is better because it is having all each and every lecture has is having the references. They are not like I have written a line or spoken out of myself. No, nothing like that. That doesn't work in reality. You have to give references to whatever you are saying, whatever you are mentioning. Like for example, if I'm writing about this interactions also, I have to give the interaction, but you can see that references one and two, 1, 3, 4, 5, 1, all has been mentioned. And when you look into the original notes of this, you will find that all of these references have been mentioned. Like you can see over here, all the references for this, for indications has been mentioned over here. Nothing is left without being referenced. Okay. Now, we are planning to come up with an expert talk on how to set up your OPD from one of our colleagues, one of our seniors, and remember that he'll be telling you about one of the basics way or like how like with minimum cost and what is the bare requirement which with which you can start your practice. So don't worry. Okay. Now how to remember references for exam? Nobody will be asking references for exam. In exam nobody asks for references, but if you write in your exam that I have taken this for CTP, this from CTP, from Tasman management, if you write from according to CPG guidelines that was there in 2026, suppose I'm writing the management of OCT, this will give you extra points. So you don't have to remember all the references which is there. Okay, now, sir, can we get two copies of hard copy? Now, we don't give hard copies because when we did our basic survey, most of the children, the students, not children, no, my colleagues and students, they like to read from phone or the PDF. So we give annotated notes. There are some people who take the printout of it. There are some people who are good to read with phone or iPad. So the options are both. Either the annotated notes are given to you, the workbooks are given to you. Okay, so we don't go with the PPT mode. First of all, no PPT. We don't go with the PPT. We'll be going through workbook. If you feel like writing in the workbook is good, which I always promote, which I always say, good for you. If you don't have time, you can directly download the annotated notes. You can read it according to open the lecture, you will read it. Final strike, yes, it includes everything. By the end of March, all components will be uploaded. So we have some of the around five different modules which are not been uploaded. But if you go up by the end of March, all of these will be uploaded. Remember, we are the only ones where you can find dedicated sections for community psychiatry. Okay. We are the only ones which you can find that we have this section of psychopathology which is covered, which covers both FIS, SHIMS and all the important articles. So you won't find it anywhere. So complete psychiatry coverage, comprehensive psychopathology series is there in Final Strike. Addiction, which is from like in this INI exam, four of our students cracked aims and they are doing their DM in addiction, three, and one DM in CL psychiatry from our own notes, which is there from addiction and also from the code red. Code red is a rapid revision thing. If you subscribe for Final Strike, you'll be getting code red. Okay, sir, I'm doing my PG from an average college, but with not many patients. Will I be able to cover it? See, Rohan, I'll just be honest. If you're doing your PG from an average college with not many patients, it's a blessing in disguise. If you have less patient, you have chances to go as in depth as possible. Will I be able to be at par with people from better colleges via SRship from better places or any other sources? Okay, I'll answer this question of yours. See, first of all, if you're doing your GRship from a college which is having a very basic kind of a setup and not many patient, try to get in-depth assessment of each of the patient. Once you are done with your GRship, try to move out and try to do your SRship from a different setup. You can come to Delhi, you can go to other places, you can go to Chandigarh, you can go to any of the places. Remember, seats in SRship is very limited. So it might not be possible for everyone to get enrolled in a particular institute of their choice for doing SRship. So please keep it a, uh, you know, like always have this thing in the back of your mind that you might not get it in first chance. Okay, so keep on trying. If not this time, after 6 months, whenever the seats are there, try to do it. Okay, so even if you're having less number of patient, in-depth assessment of each patient will make you a very good clinician, and later on you'll be able to apply those concepts and you'll be able to be a, you'll be at par with your colleagues, don't worry. Similarly, if you go to any government setup where you have too much of patients, now here you have to know that you need to know that you have to first of all tackle the load of the OPD, then you have to come back. Now in these kind of setup, you'll get exhausted. Like if you go to NIMHANS, if you go to any of the institutes like IBHAS, CIP, you'll find that there are so many patients. Again, remember that that kind of in-depth assessment might not be possible, but remember what is being followed over there, try to follow. Don't worry that about, okay, I'm lagging behind in these set of aspects. When you are being, like, for example, there is a first case of psychosis which is being allotted to you. Try to take help from your seniors, from your colleagues, how to write the history, how to take the management part, how to go with the treatment history, how to go with the MSc. Once you are done with this, I've uploaded the MSc and the neurocognitive function videos in the YouTube also. You can watch that also. Once you're done with these things, write it down. If the faculty makes mistakes, okay, if they do the correction, see, don't be upset. Rather feel lucky enough that they're giving time to you so that they can identify the mistakes. Try to rectify it in the next case. Okay, you don't have that much time in government setup when there is too much of patients. You need to move very fast, but try to rectify the mistakes from each case that you are taking so that you don't miss on anything when you are doing the next or a fresh case. So don't worry about that. So I hope that answers your question. If you are doing your residency from either of the setups, you have your benefits and you have your you know the difficulties which will vary, but remember, try to improve with each case. Okay, now please upload this session on YouTube so that maximum GR can be benefited, sir. I'll do that for sure. I'll ask my team to do this, and they'll be doing all the, they'll upload this, and I'll be sharing all this PPT, this annotated notes with you also. So don't worry about that. Now, uh, I think Dr. Prachi has something to say about, she'll be addressing you all. Just wait for some time. Kindly unmute yourself, Dr. Prachi. Yes, you can start your video also.
Okay. Good evening, everyone.
Hmm.
So I'm Dr. Prachi.
We cannot see your face. Okay, now you're visible. Okay.
So no issue. Okay. So my only message to all of you that psychiatry is very beautiful branch. Initially, when we entered in this, we are little confused. Should I take some another branch? Should I take dermat? Should I take anesthesia? Should I take medicine? It's too difficult. I don't understand anything. But with the time flows, you will understand it's very beautiful branch. Okay, initially I also felt that. Then luckily I have very good seniors, consultant, and in News Delhi, it's like my home. They help me to let grow my qualities and fight with my demons. So I advise all of you, give a little bit of time to yourself, understand it. And one important thing, it is not a neat PG, not a MBBS. Okay, and psychiatry is not just about therapy or medicine, it's a brain medicine. It's nothing less than a neurology. Okay, so we should know every aspect in deeper. And for all of you, you are not alone. Okay, we are all here to help you. So feel free to DM both of us. We will definitely reply sooner or later. Okay, so all the best to all of you. And psychiatry is no more black and white, it's very colorful and interested. Okay, and 3 year is not enough to learn. Okay, even our consultant used to say that even spending 20 years in psychiatry, I still know 5%.
So you keep on
Okay,
learning as you move ahead. Okay.
so don't think 3 year will be more enough to learn everything, and you have to learn everything in the 3 years. These 3 years to get overview of everything and fall in love with this branch. And the best teacher for you is your patient. So spend as many time with your patient as you can. Okay, we used to spend 2 to 3 hours in interviewing one patient in our first 6 months. Okay, we used to get their childhood, scan their childhood photos, report card, the guru they follow, everything. Okay, it's quite interesting. Then gradually you learn how to take a concise history. But in first 6 months, I suggest to spend as many time you can possible for you with your patient. They are the best teacher. They will explain hallucination in the way that no book can taught you. Okay.
Okay.
So welcome to the Sai universe.
Uh,
We
uh, I, by the way, I think Dr. Shruti is also over here. I'll ask her to unmute. She's currently doing her residency, so I'll take her inputs also. Shruti, you can start your video. You can unmute yourself, please. Hello, Shruti.
Hi, sir. Hi, ma'am.
So
hello.
let me introduce Shruti. She is currently a final year resident at Lady Harding Medical College and Hospital at New Delhi, and she's doing her residency. So if you want to share some of your inputs, I'll just invite you to please do share some of the insights regarding what is the difficulty that you have to face in your residency and how you overcome all of these.
So as Prachi ma'am said, ki initially when you get into this field, you will have a lot of doubts, you'll have a lot of confusions because your peers will do something else, your seniors will teach you something else, and you'd be lost, confused. But you will have to keep your calm in that moment and try to learn as much as you can. Do not take pressure in the first year itself that you'll be learning all the things. You'll learn gradually, and it's a lifelong process. अब साइकेट्री लिए तो इसी में रहना है, इसी के साथ रहना है. And it's a very fun branch. You'll learn a lot. You'll get better with a lot of things in real life also. Patients not just teach you psychiatry, they teach you how to be a better person, how to be a better person in your relationships, in your social life, and in general also how to deal with your limitations. So it's a very nice branch, and you all will enjoy psychiatry for sure. And all the very
One more
best.
question, Shruti, that I have mentioned that half an hour of every day. Do you really think that half an hour, is it possible at times to get that half an hour of reading? Is it possible?
Sir, in my experience, I would say even if that half an hour is not self-study, if you're investing it in like discussions
Mm.
with your senior residents or PG residents, or even your colleagues, that would also count if you do not feel like sitting with your textbook or iPad, and you do not feel like, because even after hectic duties, and like if you're worked up with your cases, you might not feel interested and you might feel drained out, that you do not want to spend that time with your books. You can engage in those clinical discussions, or you can watch some interesting videos on psychiatry. So just to keep that clinical information going into your brain so that you do not feel stuck with whatever you are doing. And even just reading one page about whatever case you are dealing with, it gets easy to get half an hour from one day.
Okay.
So,
And anyone else would like to ask any question to Shruti? She can, you can definitely write in the chat box. Yes, Prachi, you were saying something.
so it's not necessary to read. I am a different kind of person. Okay, I'm not that person who read 2 3 hours daily. But after, during the last 1 month, I realized that whatever we learned is through passive learning. So in our setting, our senior residents used to have teaching session with us. They ask questions and even sometimes scold us. That is a blessing. So do ask your senior residents and teachers to go through your history, rectify it, do discuss with your peers regarding the doses of drugs, the side effect, how it optimize. This is the active learning we are doing. So psychiatry is not just by mugging the books, it's by actively discuss. That's why mostly we prefer to have a session live so we can actively discuss the topic. Okay,
Hmm.
so this is how you can learn it actively and able to recall it later. So this way you can make it a very interesting thing. Okay.
Okay, Shruti, any final comments that you want to do?
Mm, just keep on learning. Do not lose hope. Manish sir and Prachi ma'am hai यहाँ पे. They'll always be there
नहीं,
for
आप लोग भी हो, ऐसा नहीं
you.
है. You all people are also there basically.
Yeah, yeah, we all are here also to help you all with anything you need. And
By the way, like we keep on learning during our senior residency also, so don't worry about that. You have to read everything in your JR ship. Senior residency also gives you an ample time where you can read a part of it. Okay. So, okay, thank you, Dr. Shruti. Dr. Ribav, are you there? I would like to call you up. Okay, I think, yes, Ribav is here. Hi,
Hello.
Ribav.
Hello, sir.
Hello, where are you?
I am just here, sir. Just a second.
Okay, take your time.
Yes, sir.
Yes,
Am
so
I
I'll
audible?
introduce Dr. Ribav first. So basically, Dr. Rivav, uh, he's doing his MD psychiatry and residency from ZMCH Sector 32, Chandigarh. He's also doing his final year, and I hope it is clear now,
Yes,
isn't
sir.
it? Okay. So He's also in his final years, so I'll also ask him to place his inputs. I'll ask him to give his inputs, like how the residency is and how you have been coping up with the residency. Yes, Reba.
Uh, I uh, I think, sir, psychiatry residency has been a ride for me. Although I'm not like I have still 4 to 5 months pending in it, so I think I'm not ready for the closing remarks. But yeah, I think it has been a roller coaster ride for me, and there have been definitely low days and high days, and I think there many people judge the branch. Many people judge you when you are moving around the hospital. Some people also have derogatory comments, and there are definitely difficult times. But I think that is the time when you have to some these are the testing times when you have to come back, and you have to tell yourself first that you are here to achieve something, and and you have to remember why you took psychiatry, definitely.
Okay, one more question, that even if they are saying any derogatory remarks or even if they demean you, does it really mean like you have to think about them? Okay, this person has said something, this person is saying something to me, but because at the end your branch is totally different. Once you start to understand the essence of your branch, don't you think that it is possible for you to just let it go later
Surely, sir,
on?
definitely. I think that is actually a part of your residency training, I guess, because maybe when once you're when you're in your first year or in your second year, maybe you are not at that good at handling your own emotions also, and maybe it is a little human to think what others are judging about you. But eventually when you take therapy for your patients, it is also therapy kind of for your own self, and you realize that the mistakes which you are teaching the patients, the distortions which you are correcting for the patients, they're also getting treated for your own self. So eventually you are also able to manage your emotions better than what you used to manage before entering the residency. So I think that is something that the residency changes in you, and that is also the very thing which is different in psychiatry than other branches, that it changes you as a person also. In no other residency, you turn out to be a better person than what you entered. Maybe in terms of knowledge, definitely, but not in terms of personality. But that is not the case with psychiatry, and that is also something which my consultants told me before I joined the branch.
Okay. Uh, One more question that I would ask you, that since you are doing your residency from GMCH 32, what is that additional benefit that you would like to mention regarding your association with GRID? I just want all of you to have this idea regarding what is GRID and how Sector 32 is very different.
Sir, I'm very happy and glad that you mentioned about grid. So, for everybody who's new here and might not be knowing about grid, so grid is the full form of grid is Government Rehabilitative Institute for Intellectual Disabilities, and it is one of its kind institute, which I think there is no other institute such as grid in India, and the kind of work which happens there is remarkable and phenomenal. There is, it was started by our late professor Dr. B.S. Chavan, and grid is an institute which which does diagnosis, treatment, and more so rehabilitation part of the intellectual disability, and also autism and not ADHD per se, but autism and other disability part also for them. So and associated with them is our department, and that is a very unique thing about our department in GMCS 32, that makes us different from other departments across the country, because we see how closely the rehabilitation part takes place. We also have a special school associated, and there are multiple vocational courses, and there are number of special educators which are enrolled there, and you get to see that thing very closely, and it's a very unique experience in itself.
Okay. Uh, Now see, if I ask you, uh, sorry, my voice is echoing, but again, I'll say that, see, every institute is having a pros and cons of its own. Okay, so it's not like that Shruti is doing her residency from Lady Harding, so she's lacking on this aspect. She might visit that place, have a look at how the management is done. Whenever a conference is being organized, they can definitely, that is why attending conference is so necessary. When you go to different places, you have to understand that what is their perspective, how they manage their cases. So this will be a very good way by which you can learn, even though you are staying in a very different institute or your friend is in a very good institute as per your view. But don't worry about this. You can visit, you can learn, and you can definitely implement all those things which you have learned from a different place, isn't it?
Definitely, sir. I would actually take this opportunity to tell everyone that at Grid, the department organizes a workshop every year. It is a certificate workshop on assessment and management of children with special needs, which obviously includes ASD and ID. So I think everybody must attend that certificate course, which happens once a year.
Yes. Why not? People can opt for that. So try to find out what is there in your institute, utilize it to the maximum so that you don't lack on any of these aspects. Okay, so I hope that with this you will be getting fair enough of idea that he is in a different institute with a very special kind of a thing. He might be lacking on some other aspects, but his different like his institute can provide a very different thing which is not available in others. But it doesn't mean that it's not available for you. You can also go, you can also learn. So don't be afraid that even if you're doing your residency from a very like a very private or a very distant institute, you are at any loss. Any closing remarks, Ribav?
I think, sir. I think, sir, closing is just that you have to hustle, and apart from residency, also I think there is a lot to do in your apart from academics. There is a lot to do in your residency, and just keep hustling. That's the only point.
Thank you, Ribav.
Thank you,
Okay.
sir.
And thank you both to Shruti and Ribav for giving their inputs regarding how the residency has been and how they have been able to carry on for the three of the like the whole of the 3 years. And I hope with this, it would have definitely given you some kind of an idea regarding how residency should be approached. Okay, how you should be able to take one day at a time, how you should be able to uh, you know carry yourself, don't get exhausted, don't drain yourself, try to be there, try to learn from everyone, try to improve your shortcomings. Okay, so with this I think it's time when we can say goodbye to each other. And it was nice interacting with all of you. Thank you all for asking your questions. Thank you to Dr. Prachi, Dr. Ribhav, and Dr. Shruti for their comments and their inputs. They were really valuable and important. And thank you all of you, those who have attended the session. Okay, thank you.